This is strike action by around 60,000 junior doctors in England only. That's around half the doctor workforce in England, and they are striking fundamentally because they want a restoration of what they claim is a 26% real terms pay cut since 2008.
So our doctors have faced, over the last 15 years, a 26% real terms pay cut, and doctors start on about £15 an hour. That's on the back of 4 to 6 years of education and up to £100,000 of debt. Frankly, doctors are just not worth that little, and we're asking for doctors to start on £21 an hour. So we're not even asking for a pay rise, we're just asking for our pay to go back to what it was worth in 2008.
Does this level of industrial action mean there's absolutely no risk to patient care whatsoever?
I think we need to recognise that there's actually significant risk to patients all year round. We have significant waiting times, not just for elective care, but in A&Es. Last year, before strike action, we saw patients waiting 24 hours in A&E departments. The Royal College of Emergency Medicine said that in 2022, there were 500 excess deaths a week. That's like 2 planes crashing every week. That's not safe. And the fact of the matter is that we have a supply and demand issue. Demand for healthcare is very high, we don't have enough doctors, and the government's solution to that is apparently to cut our pay and drive us away.
The British Medical Association, who represent these doctors, also say there's a problem with the retention and recruitment in the NHS. Just give us an idea, how tough is being a junior doctor?
It is quite tough. While living in London, seeing all the expenses, and with the pay we get, everything is spent. We can't save anything, we can't send home money back, so it's quite difficult for us.
So what has it made you think maybe go private or go to another country? Or
At least I've been in a number of discussions where people have talked about moving to other countries like Australia, Canada. So it's a real discussion ongoing among staff in the NHS.
Yeah, and you've heard similar discussions as well?
Exactly, yes. I've heard many of my colleagues, they are fed up from the NHS because of the pays and everything, and they are planning on moving to Australia. Some of them are trying to move to US.
Yeah, is that something you guys would consider?
We will eventually, yeah, if the government doesn't listen to us, so we will, yeah.